Hello friends, in this video I'm going to talk about pulmonary ventilation, respiratory muscles and the mechanism of inspiration and expiration. Let's begin with the introduction of pulmonary ventilation. So what is pulmonary ventilation? When I used to study pulmonary ventilation, I had confusion between the two terms pulmonary ventilation and alveolar ventilation. So let's just clarify our doubts and so that no confusion is left, right? So pulmonary ventilation is the addition of the air that is inhaled and the air that is exhaled and the exchange that actually occurs between the gas and the blood. Now you need to remember one thing, that pulmonary ventilation is concerned with both the air that is entering the respiratory tract and the exchange of gas that is occurring between the blood and air. That is the thing you need to remember. Now if you need to know about alveolar ventilation, you have to remember that alveolar ventilation is not concerned about the air that is entering the respiratory tract. It is concerned about the air exchange that occurs between the blood and the air, right? So it is actually concerned with the exchange of gases between blood and the air. Okay, it is not concerned with the respiratory tract, but pulmonary ventilation is concerned with both. Okay, so that's the basic difference. Now let's see we have a formula of pulmonary ventilation, which is equals to tidal volume into respiratory rate. So tidal volume is the air that enters or that leaves, anyone you can take, during a normal respiration, right? So it is normally 500 ml, and respiratory rate, as we know, is 12 to 16 per minute, right? So if we calculate this, we get the answer 6000 ml per minute. Okay. Now to study the mechanism of inspiration and expiration, we need to know some basic laws, and one of the law is Boyle's law. Okay, now Boyle's law we have already studied in school level, but we will have to revise it so that we can have clear idea about the mechanism, right? So Boyle's law states that under constant temperature, the volume of a fixed mass of dry gas is directly proportional to the pressure exerted on it. Okay, so I have shown one example here, that we have a fixed mass of gas in both the in the same container. Now as we decrease the volume, we know that if we decrease the volume, as I have shown here, the amount of gas is going to remain same, right? The molecules will be same, and now the space occupied by the same amount of gas is less, and hence the pressure will be more. So we can say that when the volume decreases, the pressure increases. So if simply Boyle's law is pressure is inversely proportional to volume, only that the temperature and the mass of the gas is constant. Now we are going to apply the same Boyle's law to understand the mechanism of inspiration and expiration, right? So few things that you need to remember is that our chest, we know, right, that our chest is a closed container, right? Because we know that it is a closed container, that it does not have any opening or any of the space that the air can come out or go in. So first thing is applicable here, that the container is closed, right? So we can apply Boyle's law. And the second is body temperature. Our body temperature is almost constant. So we have the fixed mass of gas and we also have the fixed temperature. So we can apply Boyle's law. Now the second thing you need to remember is that there is no attachment between lung and chest wall. Okay, so this lines that I've shown is actually the lubricating fluid. There is no attachment between lung and the chest wall that you need to remember, right? So what actually happens is, anyhow, we are going to expand the chest wall, or we are going to increase the volume of this cavity, right? So we are going to increase the volume of this cavity. Now, but if we increase the volume of the cavity, you can see here that there is no attachment, then how will the lung stretch? Right? That is the question. Now, we know that volume is inversely proportional to pressure. So as volume is going to increase, the pressure is going to decrease. So as the pressure is decreased, there will be a suction force, right? There will be a suction force that will allow the lung to expand, right? So the lungs will expand in the cavity, and it will force the alveoli to expand also, right? Let me explain it again. Now, as the chest cavity volume has increased, the intrapleural pressure, the pressure in between the two pleura, right, has decreased, right, because the volume has increased. So the pressure has decreased, so there will be a suction force created on lungs. So force will be created on lungs, and lungs will get space to expand. Now as it expands, it will also force alveoli to expand, and this will create a negative pressure in the alveoli. And we know that air flows from the positive pressure to negative pressure, right? So air flows out from the atmosphere to the negative intrapulmonary or the negative alveolar pressure. So air will flow from the airway tract to the alveoli. Okay, so now how we'll see the two ways to increase the chest, the volume of chest cavity, right? The first muscle that is acting is diaphragm, a dome-shaped muscle which is a key muscle for respiration, and no other muscle can actually replace, no other muscle plays the same important role. It helps in 75% of respiration, and it is the muscle acting in normal inspiration. Okay, so it is the main muscle of respiration, you can say that, right? So what happens actually is the phrenic nerve that supplies the diaphragm. When the respiratory centers, we also have a separate video. I'll be making a separate video for the control of respiration, but for now you need to remember that the respiratory centers stimulate phrenic nerve, and it will cause the contraction of diaphragm, and the diaphragm, as you can see, will flatten, right? You can see the diaphragm flattened. Now the volume has increased, pressure has decreased, lung will inflate, and alveoli will inflate. Air will come in, right? That you need to remember. Now the second mechanism we have is the internal intercostals, external intercostal muscles. It's external intercostal muscles. Now you have to remember that external intercostal muscles are inserted in front. Okay, so they are coming like this and inserted in the front of the body, right? So they are originating from back and the upper rib and inserted in the lower rib in the front. Now when it will contract, it will bring the rib like this, right? So I can show you like this. Okay, so if we have two ribs, it will bring the lower rib outside, right? So you can imagine that this way it is going to increase the volume of the chest cavity. Okay, and this is the bucket handle movement. You can see that it will raise the lower rib and a sort of the bucket handle, so it is also known as bucket handle movement. Now the second movement is the pump handle movement. It is also caused by the external intercostal muscles only, but it is caused by the external internal costals of the first two spaces only. Okay, now what it will actually do is that when it contracts, it will cause the sternum to be the sternal, the upper end will come closer and the lower end is going to be far away, right? So this is the initial position, and the dotted line is the position after the contraction of the external intercostals, right? So it will be like that first it is in this position, then it will be in this position. So it will increase the chest cavity, right? Now this is a side view, okay, if you can so this is a side view, and you can guess that it is a pump handle movement. If you've seen a pump, there is a handle